Chapter 18, last lecture. Woohoo! You're almost to the end, y'all. Well, we are at the end. We're at the end. We're at the end. Woohoo! Okay, get it together. Chapter 18, managing barriers to change. Okay, here we go. Central idea. Um, Resistance is information. This is so important, y'all. When a client is making changes we expected, or is not making changes we expected, or is not completing agreed upon tasks, misses appointments, changes the subject, right, avoids the conversations that we need to be having, repeatedly says yes to suggestions, but doesn't follow through. It's really easy and tempting to think that the client is just not motivated. But as social workers, we need to ask a different question. What is this behavior telling me? Okay, that's really important because it's telling us something is getting in the way. What is it? Number one, be careful about labeling someone as resistant. So the word resistant can become problematic because it places responsibility entirely on the client. And it's a label in a sense. So consider a client who's repeatedly agreed to apply for jobs but hasn't submitted a single application. So we could maybe write in a note the client remains resistant to employment. But that doesn't really tell us a whole lot. It tells us very little. So instead, we might need to explore, well, what is happening, right? So maybe the client fears rejection, or doesn't have transportation, or appropriate professional clothing, or doesn't know how to complete an online application, or they're worried about losing benefits maybe they already have. They don't have childcare. They lack confidence. They've had a negative experience in a previous workplace, and it's keeping them from applying for a new job. Or maybe they don't actually share the worker's goal of obtaining employment. Maybe it's not the client's goal. So lots and lots of possibilities, and they each require a different intervention. So instead of asking, well, why haven't you done this yet? We might say, so we talked last week about completing an application, and that didn't happen. What got in the way, right? So this little shift changes the tone. We're using accountability instead of judgment, and also we're exploring. Next, ambivalence is normal. This is so important, y'all. It's probably one of the most, it's part of the change process. People want something, or they can want something, and not want something at the same time, right? So a client may genuinely want to leave an unhealthy relationship, and they might love their partner, right? Or they might stop drinking and enjoy drinking with friends. Or they might want to get a job and feel really scared about going back to work. Or they might want to move out of their parents' house, but they're afraid to lose their support system, right? Both sides can be true. And sometimes we might interpret this as an inconsistency. Like, for example, we might say, well, last week she wanted to leave him. Okay, well, yeah, she may still want to leave him, but she may also desperately want the relationship to work. That's ambivalence. That's, again, it's a normal part of change process. So our job is not necessarily to eliminate ambivalence immediately. Sometimes we need to first help the client talk openly about both sides. So you want to leave, let's talk about that, but you love him, let's talk about that. Next, we don't want to get into an argument for change. So this kind of connects nicely with motivational interviewing that you may have heard about. So imagine a client says, I know everybody thinks I drink too much, but it's really not that big of a deal. And so maybe the worker responds with something like, but you already told me that you've missed work 3 times because of drinking. And then maybe the client says something like, that's not because of my drinking, that's because my boss is like totally unreasonable. Okay, so now look what happened. Now the social worker is arguing for change and the client is arguing against the change. And this is the opposite of what we want. So instead, we might say, so what do you enjoy about drinking and what are some things you don't enjoy about it? Now we give the client the opportunity to articulate both sides, and it gives us room to explore. Bringing in motivational interviewing principles is really helpful. So you don't necessarily have to do a deep dive into motivational interviewing, although you need to know it, and it's an extremely helpful skill in practice. But a couple things I do want to highlight here. Number one, in terms of motivational interviewing, collaboration. So we're working with the client rather than doing something to the client. Autonomy, so clients make their own decisions. Again, we provide information, explore consequences, offer resources. We help evaluate choices, but we don't pick the choice. The client does. The client controls the choice. And number three, vocation, and that's instead of giving clients a long list of reasons why they should change, we help them identify their own reason to change. So for example, instead of you really need to stop smoking because it's affecting your health, maybe we can say, if you decide to quit smoking, what would be the most important reason for you? And maybe the client says, honestly, I want to be able to play outside with my granddaughter without getting winded. That's their reason, right? And that's way more powerful than ours. Next, we want to consider environmental barriers, and this goes back a couple chapters to person in the environment perspective. So not every barrier to change exists inside the client. Example, maybe a client misses a bunch of therapy appointments, and so it would be really easy for us to interpret that as they're not committed to treatment. They're non-compliant, right? But maybe they rely on public transportation, or maybe their employer won't let them leave work. Maybe they don't have childcare. Maybe their insurance doesn't cover certain providers. Maybe the appointment conflicts with other responsibilities that cannot be easily changed. So instead of interpreting the behavior as a psychological barrier, we also want to ask, and it's important that we do, is there something in the client's environment outside of their control making this change difficult? That's what's giving us the chance to look at this through a social work lens. Next, examine your own role when progress stalls. So sometimes things don't it's easy to assume it's the client, right? When things aren't working. But we also have to look inside of us. Self-reflection is so important, and that's why supervision is so important. So when you're feeling stuck or when a client seems to have stalled, seek supervision, process, do the inside work on yourself, and ask, whose goal is this? Sometimes we become more invested in a goal than a client has. Maybe did we move too quickly? Maybe the client wasn't ready for the intervention that we introduced. Is my approach culturally responsive? So maybe I'm defining a healthy behavior according to my own values or my own culture rather than understanding the client's cultural or family context. Are there environmental barriers, which, maybe we've developed a beautiful treatment plan. We can all do that, but it isn't realistic given the client's resources. Have I misunderstood the problem? So maybe what we initially thought was driving the client's behavior isn't really what's happening. And most importantly, do I need to change my approach? So good social work practice requires us to be willing to reconsider our own interventions, okay? One thing to remember, instead of asking what is wrong with this client, ask what's getting in the way. This question leaves room for ambivalence and environmental barriers, cultural factors, fear, competing priorities, and even the possibility that we, as the social workers, may need to change our approach.